The Tendyne transcatheter mitral valve replacement device is really for patients that really do not have another option to treat their leaking mitral valve. Mitral valve leakage or regurgitation is one of a major cause of congestive heart failure. And when patients are not candidates for conventional surgery or other therapies, prior to this type of technology, they would only receive medicines and have a very poor quality of life and limited survival. With this research today, which is ourselves at WVU, along with international collaborators from Australia, Europe, and around the United States, have shown that in patients with large hearts and severe leaking of the valve, where other therapies have failed, this particular therapy seems to excel. And that's the significant contribution that we've been able to help with the literature today that was presented and simultaneously published. Many of us in the specialty focus on mitral valve disease and its therapies. At WVU, it is one of the major specialties that we have, and the team approach includes heart failure physicians, interventional cardiologists, imaging cardiologists, and surgeons. And we all together work in unison to determine the right therapy for the right patient at the right time. That's part of our core mission for the state of West Virginia. And we often do robotic mitral valve repair, replacements, transcatheter mitral valve repair. So we were the first in the state to do the mitral clip, which is instead of surgical repair, we place a catheter up the groin and go inside the heart and bring the two leaflets together to do what's called an edge-to-edge repair to stop the leakage. But in cases where all of those therapies are not feasible or appropriate based on the patient or his or her risks, that's when we can now use this transcatheter mitral valve replacement device. And we started this a few years ago, and we find that it's quite a safe procedure, despite how high risk these patients are. And so it's enabled us to treat patients with this disease where we couldn't before. And that's why we feel that that's rewarding for us as providers for our state and region, but also allows us to contribute to the progression of the literature and the care of patients around the world. Part of our mission at WVU and the Heart and Vascular Institute is to innovate while we care for our patients and take the knowledge that we gain at WVU and at the Heart and Vascular Institute and share it with the rest of the world. And this has been a privilege to be working with all the physicians at HVI, but most importantly, many of our providers do the exact same, and they travel all around the world and speaking about this. And what this does as well is it brings other physicians from around the globe to WVU to learn some of these things. In fact, we have people visiting on quite a regular basis now. In fact, I think even in a few weeks, we have surgeons coming from around the world to watch some procedures. So it's part of the development and our contribution to the state, and that's an extremely rewarding thing to do and a privilege to do so.